Let's talk about IBD and IBS. You've definitely heard the names, right? Inflammatory bowel disease and irritable bowel syndrome. They sound so alike, people use them interchangeably all the time. But here's the thing, they are worlds apart. So let's dive in and finally clear up all the confusion.
If you've ever dealt with serious gut issues, this question has probably kept you up at night. The symptoms can feel frustratingly similar, making you wonder what's really going on. But figuring out the difference isn't just a small detail, it's absolutely critical. So let's break it down.
And it all starts right here. If you remember one thing from this explainer, make it this. The huge difference between IBD and IBS boils down to one being a structural problem and the other being a functional one.
Okay, so when we say IBD, and remember, that's the umbrella term for Crohn's and ulcerative colitis, we're talking about real, visible, physical damage. A doctor can go in with a camera and they will actually see inflammation, sores, ulcers. The very structure of the gut has been changed by the disease.
Now flip that completely on its head for IBS. With IBS, a doctor can look inside with that same camera and everything looks, well, totally normal. The scans are clear, the biopsies are clean. That's why we call it a functional disorder. The gut structure is fine, but the way it works, its function, is all out of whack. I love this analogy because it makes everything click. Think of IBD as a hardware problem, like the physical parts of your computer are broken. But IBS, that's a software problem. The machine itself is fine, but the code, the communication between your gut and your brain is glitching out.
All right, let's talk about symptoms, because this is where it gets really tricky and where most of the confusion comes from. On the surface, these two conditions can feel incredibly similar day to day.
And just look at this list. Belly pain, bloating, unpredictable bowels, that sudden panicked need to find a bathroom, you get all of that with both. So it's no wonder why it's so easy to get them mixed up. You feel awful, but the why is still a huge question mark. But this is where you need to be a detective. The symptoms on the left are what doctors call red flags. Things like blood in your stool, losing weight without trying, fevers, or even inflammation showing up in your eyes or joints. Those are serious signs that point towards the physical inflammation of IBD. IBS symptoms are awful, for sure, but they don't usually come with these big systemic alarms.
So because these two are so fundamentally different, structural damage versus a functional problem, it makes perfect sense that the way doctors figure it all out is completely different too. With IBD, it all comes back to that hardware problem we talked about. The entire goal of the diagnostic process is to find cold, hard proof of damage. It's a search for physical evidence.
And these are the tools for that search. Doctors will run blood and stool tests looking for signs of inflammation. They'll use scans like a CT or MRI, but you know, the real gold standard is a colonoscopy. It lets them see the inside of your gut directly and even take a tiny tissue sample, a biopsy, to prove under a microscope that there's an inflammatory disease process going on. Now, the journey to an IBS diagnosis is a whole different ballgame. Since there's no physical damage to find, it's less about what tests show and more about what they don't show. It's a diagnosis based on ruling other things out and then carefully looking at the specific pattern of your symptoms. Doctors have a very specific checklist for this, often called the Rome criteria. And as you can see, it's all about patterns. Are you having belly pain regularly over several months? And is that pain clearly linked to your bowel movements? When you go, how often you go, or what it looks like? If the answer is yes, and all the tests for IBD come back clean, that's when a doctor can confidently say, this is IBS. Okay, we've arrived at the most important part of this whole conversation, the so what. Why does getting the right label matter so much? Because it completely changes the game plan for treatment and your health down the road. This slide just lays it out perfectly. With IBD, the goal is to shut down the inflammation. That means using powerful drugs that actually suppress your immune system to stop it from attacking your gut. With IBS, the goal is to manage the symptoms. The approach is totally different. It's about things like diet changes, stress reduction, and specific meds for diarrhea or constipation. And this quote just hits the nail on the head. Those heavy-duty IBD drugs, they do basically nothing for IBS, and they come with serious risks. So you can see why giving the wrong medicine for the wrong condition is a really big deal.
And the reason it's such a big deal is that the stakes, especially for IBD, are incredibly high.
If you mistake IBD for just IBS and you don't treat it, that inflammation just keeps simmering away in the background, causing real, lasting harm.
And this is what that harm can look like. We're talking about scarring that narrows and blocks your intestines. We're talking about chronic bleeding and malnutrition. And most seriously, that constant inflammation dramatically increases the risk of colorectal cancer over time. This is why getting the right diagnosis early isn't just important, it can be life-saving.
Now, for anyone listening who has IBS, there is some really reassuring news here. While the symptoms can make your life miserable, IBS does not cause that kind of permanent damage. It doesn't scar your intestines, and it does not raise your risk of cancer. But, let's be clear, that doesn't mean it's not a serious condition. It can absolutely destroy your quality of life.
So it all comes back to that one core idea. Is it a hardware problem or a software problem? Understanding that difference is the key that unlocks everything: the right tests, the right treatments, and the right outlook for your health. Hopefully, you now feel armed with the clarity you need to go have a much better, much clearer conversation with your doctor.
Don't forget to like and subscribe.